It is a common question for pregnant women. Should I get a COVID-19 vaccine? There's a new study out of Northwestern Hospital that could help them make that decision. It found a COVID vaccination earlier in pregnancy leads to better antibody transfer to the baby. This morning, we are joined by the study's author, Dr. Emily Miller from Northwestern University's Feinberg School of Medicine. Good morning to you, Dr. Miller. What a pleasure to have you. Such an important topic. This is really important because a lot of women, pregnant women, have considered delaying this vaccine until after delivery for fear it could harm their baby. But your study found the exact opposite. So tell us what it revealed.
Yeah, so what we were able to do is we identified 27 pregnant people who received the COVID vaccine in their pregnancy, and we could collect maternal blood and umbilical cord blood, so an assessment of the blood in the baby. And I think we found three important things. One, we saw a robust immune response in pregnant people. Now remember, pregnant people were excluded from those original trials. Right. So this data, building on data that's coming out from other centers, tells us, hey, this vaccine is likely effective in pregnant people in the same way it is in non-pregnant people. That's huge. In addition, we found that those antibodies transfer to the baby. And so that protection that a woman gets is transferred to her infant. And then I think the really interesting thing that we found is that transfer is more efficient as more time goes by. So the earlier we get it, the more likely we are to have an efficient transfer and to be able to get a protective immune response for the baby.
And that's what I wanted to talk to you more about too. But you brought up, you just highlighted something which I think is so important, that early on the clinical trials were not being done on pregnant women. Pregnant women were left afraid, saying, oh, I don't know what to do. And now your evidence, as you said, this is huge. It's showing that, wow, not only is it helping the mom, but it's affecting the baby. So at what point did you start the testing? How early in the pregnancy? And how early would you recommend the vaccination?
Such good questions. And I will say there's still a lot of unknowns. So what we were able to do is look at people who were already getting the vaccine. And remember, it hasn't been around that long. So it's effectively just those in the third trimester, and truthfully, mostly just healthcare workers at that point. And so I think we are planning to follow this progress and see what happens in the second trimester and even the first trimester. But again, I think while this infant data is interesting, at the end of the day, the most important thing is keeping a mom safe. Right. And the best way to do that is by vaccination. So while I think we'll have more data to come, I think it's really important not to forget that vaccinating pregnant people is a way to keep them safe and protected during the pandemic.
Very good. I want to bring up this other study that came up last week that revealed COVID-19 led to a global increase in stillbirths and maternal mortality, in part because some women were reluctant to go to the doctor for fear of exposure to COVID-19. I'm curious if you're familiar with this study, and is your hope that the results of yours could have an impact on this?
Yeah, it's such a really good study, and I'm glad to have the data. I think those are data that are truthfully something we've seen before in other pandemics, but they're really a call to action. We saw health services disruptions related to the COVID-19 pandemic, and it's taught us that while there's been a lot of positive steps, there's been a lot of missteps, and we need to figure out urgently how we can deliver safe and effective pregnancy and postpartum care that's accessible and that's equitable.
Okay, so bottom line, Dr. Miller, this is your chance to talk to those women who are pregnant at home or potentially pregnant. Maybe they're only in the first few weeks of their pregnancy. What do you want all of them to know?
I think the important thing is partner with your obstetric clinician. We're here to answer questions. We absolutely have limited data. We're really working as quickly as we can to generate as much data. And our job is to disseminate it to you, to be transparent, to be open and honest, listen to your questions. So please reach out, stay safe. And there is an end in sight.
Okay, well, keep up the good work. I'll be looking forward to hear about the results of your continuous study. We appreciate your time, Dr. Emily Miller, Northwestern University's Feinberg School of Medicine. Have a great day.